Hi everyone, I'm Dr. Anil Khetrapal, Head Department of Transfusion Medicine and Blood Center at the prestigious Artemis Hospital, Gurugram. Today, I'll be speaking to you about the importance of blood donation in our life, in brief. Now, the aim of any blood transfusion service is to ensure availability of safe and quality blood at all times in quantities as required for its patients. Now, this can only happen if we come forward and donate. The question which comes to our mind is, why should we donate blood? We should know that our body has got about 5 liters of blood in it, and even if we donate part of it, it is not going to make any difference. Further, people who need blood are from the time since they are born, and because of increased longevity, people are living longer and they need blood at all times, whereas people who can donate are between the ages of 18 and 65 years only. And if it is seen that if we donate, even if 1% of our population donates blood, it is adequate to meet the demands of our country. Now, who can donate blood? Anyone who is between the age of 18 and 65 years can donate blood. The hemoglobin has to be more than 12.5 grams, irrespective of whether it is a male or a female. And the body weight has to be more than 45 kg. If it is between 45 and 55 kg, one can donate 350 ml of blood. And if it is beyond 55 kg body weight, one can donate 450 ml of blood. And other things which I see is that the person should be physically and mentally fit for donation. And if there is anything found that he is unable to donate, he is temporarily or permanently deferred. Now, what is the donation process? When a person comes for blood donation, he has to first register himself with the blood center, and for which he is given a donor questionnaire and a consent form, which he has to fill it up. Assistance is provided if required by the staff of the blood bank. Now, this questionnaire has got all questions pertaining to the donor safety as well as the recipient safety. And these questions need to be answered honestly by the person. Then once he has answered all the questions, a brief medical examination and screening is carried out on the blood donor by way of hemoglobin estimation, record of temperature, pulse and blood pressure. And this helps in finding out whether the donor has got any evidence of hypertension or anemia, and should he require any treatment, for which he is advised accordingly. So once this has been done, he goes for blood donation. Actual blood donation process, it takes not more than 5 minutes. During the donation also, he is counseled so that first-time donors and female donors do not have any adverse effects after the transfusion or during the transfusion. Once the donation process is over, he is given refreshment so that we buy at least 10 to 15 minutes to observe the donor under critically, so that if there is any untoward events, adverse effects, he is immediately we take action and take care of him. After the blood donation, he is given a blood donor card which he has to keep and understand that what he has to do after blood donation, so that it is a safe donation and he doesn't experience any adverse effects of transfusion. Now, other thing is, what are the benefits of blood donation? You'll agree with me that by donating a unit of blood, we get a sense of pride that we have done something for the society. Besides, it is good for our heart, good for our brain, so that there are less chances of getting heart attacks or stroke. This is because blood donation decreases the blood viscosity and chances of thromboembolism. So that and also it also decreases the excess iron in the blood. Now, this excess iron can be harmful to the body by way of increased incidence of chances of infection, and it gets deposited in our vital organs like liver and heart, and causing their impairment in function. So we should always come forward and donate regularly. And the other thing is that the other benefit that we can consider is that during blood donation, certain tests are carried out free of cost, like HIV, hepatitis B, hepatitis C, syphilis and malaria. Besides, one also gets to know about the blood group of the person. So these are the advantages of blood donation. There are few minor disadvantages or side effects like feeling of fainting, or the other thing is like hematoma formation or bruise formation at the site of the vein puncture. So these are all minor issues which get resolved very soon. And so what we prefer is a voluntary, non-numerated, repeat, low-risk blood donor, so that this ensures safety of the blood. Through this, I will request all the society to come forward and donate regularly. Thank you.